Hi everybody and welcome to today's webinar. We're going to be having a question and answer session about coronavirus at work, and I'm going to be joined by some colleagues shortly, colleagues from across the TUC. But first of all, a big welcome to all of you who've signed up and tuned in. It's fantastic to see so many people joining us. Certainly because it's very much a different world from what we've been used to in the past few weeks, and we really appreciate that there's a huge need for the TUC to offer support and guidance to all union reps especially, but also anyone in the world of work who's facing problems. And before we begin with the webinar properly and answering, before I hand over to some of my colleagues, I think we all want to give a big thank you to colleagues and workers across the city who are keeping the country running for us. We really do owe you a lot. So thank you from all of us. We are encouraging you to chat in the panel to the side. You'll see that there's quite a lot of activity going on there. We'd really like it if you could introduce yourself, say your union and where you're joining us from today, like the town rather than maybe your home. I'm in my home. I'm sure many of you will be also. And post any questions that you've got for us about coronavirus at work and the issues you might be facing. We will try to answer as many as we can today, but I don't think we're going to be able to get to them all. But rest assured, we are making note of them all, and we will answer them in some way, shape or form, be it on another webinar or in a written format, and we'll send them out to you via email. So do keep sharing your experiences with us and posting any questions you may have. My colleagues are busy in the chat panel, and any resources or links that are mentioned or that we think are useful, we'll post them there in the chat for you to access in your own time. But we'll also send these links round after the webinar has finished, along with a link to a recording of the webinar. So if you miss any of it or you can't stay till the end, don't worry, because we'll make sure you get sent a recording to it. So I'm going to hand over now to my colleague Tim, who will be answering some of the questions that we've had about employment rights and giving you an update on the situation. So over to Tim now. It might take a second or two for him to join us. Just waiting for Tim now to join us. He'll be with us in a sec. Okay, Tim, we seem to be having some problems connecting to you at the moment. What I'm going to do instead is hand over to my colleague Shelly, who has been looking at some of the questions that we've had regarding health and safety. Tim, I'll come back to you in a few minutes, and hopefully we'll have sorted out the connection. So Shelly, I'm going to pass over to you now. Hello. Welcome, Shelly. Perhaps you can answer some of the questions we've had about coronavirus at work from a health and safety perspective.
Yes, absolutely. Hi, everybody. My name's Shelly Asquith. I'm the Health, Safety and Wellbeing Policy Officer at the TUC. I've received a number of questions. I'll see how many we can get through today, because we've obviously got colleagues of mine that are going to look at other specialisms. But I've got this one that says, I have raised the topic in my organisation of people working from home who may need workplace assessments. Many workers use ergonomic equipment at work because of disabilities or learning needs. Some people in another organisation have been told not to remove ergonomic equipment from their workplaces, but how can they be expected to work from home? So, of course, because we're not allowed to be leaving home at the moment, we can't currently be having those assessments of our workplaces done to see if they're safe or appropriate. But this is actually really serious, and the way many of us sit for up to 7 hours a day at a time at work can cause really serious injuries, especially in our backs and our necks, shoulders. And it's in your boss's interest that you safeguard against these injuries, because it's going to end up with you taking more time off sick in the future. So it seems very unreasonable to me that employers have stopped people actually taking ergonomic equipment home. I'm going to show you an example of what I'm sitting on at the moment, which is designed to support my back and support my spine. These are the kinds of things that your employees should be encouraging you to use, not stopping you from using. So in this instance, I would say the union should write to bosses and demand that they identify certain items which employees can purchase to make home working more comfortable for them. And the employer should agree to reimburse workers for buying those things, or ideally, actually, the employer should buy them outright and get them sent to you at home. Now, this might include laptop stands, so your screen is at eye level, so you're not having to look down and strain your neck, for example, wrist supports when you're using keyboards and mouse mats, adjustments for chairs to support good posture. There'll be other things that'll be appropriate to your particular type of work, and we can send some links around later as well to examples of suppliers for those sorts of things. Okay, another question. If someone has been sent home with a cold, should the desks be sectioned off and deep cleaned, or at least cleaned? Now, I don't know if this person is still working in the office, but let's say that they are. Desks should be being cleaned more regularly, regardless of whether anyone in the office has got a cold. And if your employer isn't doing that, you should demand that they start to do that immediately. Now, that includes properly cleaning keyboards, mouses, telephones, and any other equipment that gets touched regularly by multiple numbers of workers. So, for example, the kettle, printers, door handles, light switches, things like that. And unless other workers are using that particular sick colleague's desk, I don't see why it would necessarily need to be sectioned off if it's being cleaned. Those are kind of safeguarding that should be happening already. So as I said, I don't know if this person's, the new rules as of today mean that they're not in the office anymore, but say that they're a public service worker who is still going in. Certainly, if your bosses are enforcing hot desking, so people are still using that sick person's desk, you should ask them to stop hot desking immediately. And this should also be a demand longer term as well. Hot desking is not only really unhygienic, it's bad for workplace morale and various other reasons. There's an example actually, which I wanted to draw on, of a union branch carrying out a how clean is your hot desk experiment, similar to the How Clean Is Your House TV series from a few years ago. And they took swabs of keyboards and desks and sent them into a chemistry lab to demonstrate just how many germs are there on people's desks. And it kind of grossed a lot of people out, and it forced the employer to kind of introduce cleaning. Just sending you that link now to read about it. So that is the advice I would give in those sort of situations. Okay, I've got another one here about underlying health conditions. What stance should people be taking with regards to underlying health conditions in the workplace? Now, the guidance on this, I think, has been quite unclear until yesterday. So yesterday, the NHS sent text messages to hundreds of thousands of patients, and it's going to be writing to a total of 1.5 million patients who it deems at most high risk and who require what they call shielding. Now, this includes those who've recently had an organ transplant, who've been on certain cancer treatments, or who have other sort of certain medical conditions. And these people are being told to self-isolate for the next 12 weeks and to not come into physical contact with anyone or leave the house at all. And employers must not be asking them to come into work. If they can work from home, then that's obviously fine, but this must be done in isolation. For those who don't fall into that category, there are people who are at moderate risk who are advised to stay at home as much as possible, and they could face complications were they to contract COVID-19. So this again includes certain medical conditions and people on specific medication which reduces the capacity of the immune system. There's a list of those illnesses in our own guidance, which hopefully a colleague of mine can send a link to in the chat box now. But the best thing to do is to contact your specialist team or consultant and ask for their advice, because that list is changing all the time and different advice is coming out from specialist teams. And where the recommendation is to completely self-isolate, again, you should not be expected to go to work. You should not be expected to travel to work, I should say. Obviously, working from home is different. And this applies even if you're a key worker. And really, it also ought to apply to anyone else in your household so that they're not coming in and bringing contagion into the household. But I can't stress enough that your relevant healthcare teams, whether it be a cardiologist or something else, they will know about the severity of your specific condition and what measures you personally need to take. And therefore, reps have a responsibility to then be ensuring that no employer is asking any worker to attend work if they have those that medical advice saying otherwise. And again, we need to be fighting for anybody who is unable to go to work and therefore can't work from home, can't carry out their work. They should be receiving full pay. Nobody should be financially worse off for trying to save their own or other people's lives. I've got another question here, which is quite sector specific, but it's about social distancing in school. So I think a lot of parents as well will be interested in kind of what the guidance is around this. So it says, we are getting a lot of questions this morning from teaching assistants in schools regarding whether the children of key workers should be sitting far apart, playing together. Should the teachers and support workers be issued with PPE, that's personal protective equipment? So yes, the advice on this from the education unions to school leaders is pretty clear. And if this is not yet being implemented in your school, union reps should demand that it is. So it says, avoid so far as possible physical contact between children and with children. Find alternative means to comfort children who might be distressed or anxious that doesn't involve physical contact. As far as possible, avoid games and activities which lead to physical contact. Where children complete work, don't collect it in at the end of the day. Ask them to take it home instead. Spread children out as far as possible when in the classroom, when eating. And ideally, they say 2 meters apart, which is, again, the advice that everybody's been given in terms of that social distancing. Children should walk single file when moving about the building and must not hold hands. And the break and lunchtime should be staggered where possible so that the playground and dining area doesn't become crowded at any time. In terms of PPE, as yet, the advice is that PPE is really only required for health and social care workers. Gloves may be issued to postal workers and shop workers on request in some cases. And there's certain PPE recommended to cleaners as well, depending on the type of work that's being done. But the education union's advice in terms of for school workers is to limit the number of people who are at school, so having staff on a rota. Spaces should be being cleaned more often, and soap, warm water, tissues, bins should be provided within easy reach, ideally in every classroom. Windows should be kept open for ventilation. Now, I appreciate that in some days that might mean it's quite cold, so you might want to, as a union rep, raise the fact that people should be maybe wrapping up a bit warmer where that is the advice being given. And any children who are presenting any symptoms should be sent home. Now, the National Education Union also is calling for testing to be made available in schools as soon as it has been made available to health workers. So that's something to bear in mind as well. How are we doing for time? I'm aware that we've got other colleagues that need to come in. I'm hoping that I'll just be cut off when I've run out of time. So my next question is there a limit to how many times you can choose to self-isolate if you get reoccurring symptoms? Does anyone know how long it takes to get rid of the virus and if you can get it more than once? Now, in terms of choosing to self-isolate, that's not really a choice anymore, is it? Because we've all been told to stay at home, unless we're, of course, a key worker or leaving the home for those 4 reasons. There are no rules around this in terms of how many times, and the advice is kind of so far-reaching now that essentially everyone is asked to self-isolate where possible. But union reps should be making the case for periods of self-isolation to be discounted in any absence reviews to ensure no workers are penalised for prioritising their health when they go back to work. And when it comes to getting rid of the virus, that's not yet clear. So there are various studies that are showing various amount of times, and it really depends on your own current health situation as well in terms of how long that might take for your body to fight the virus. It does seem as though people can be reinfected with it. It's not yet clear if patients develop immunity after fighting the virus off, or whether some do and some don't. Research is still being done constantly by scientists, so we're just kind of keeping our ear out. Latest research around that. I got a couple of questions through from bus drivers, so I've grouped those together. And one says, I work in the public transport sector as a bus driver. What should my employer do to protect us? And the second one says, the government have strongly advised those with underlying health conditions which require the yearly flu jab to practice social distancing, which includes restrictions on the use of public transport. I fall into this vulnerable group. How can I comply with this guidance as I'm a bus driver and my work have provided no guidance or guarantee of the 80% payment? There's a lot in that. So it's a question that I think a lot of key workers who will be coming into contact with members of the public are asking and are thinking about and are concerned about. Your employer should be ensuring your bus, or indeed your place of work, no matter where you are, is cleaned more regularly. Ideally for bus drivers, it should be at the end of every route. So hopefully this is possible after routes have been reduced already, that there is time factored in for that to happen. If you're on a bus without a screen between you and the passengers, then you should be asking your bosses what they can do to better shield you. Are there things that can be put in place temporarily? They should be asking passengers as well to use card payment where this is possible, to save you having to handle cash, or to save those who cash up at the end of routes to handle the cash. And they should certainly be providing you all with hand sanitizer and the facilities to wash your hands at the garages at the end of your shifts and end of your routes. If you're in an especially vulnerable situation, which it sounds like this person is, then it may be that you shouldn't be going to work at all. And if there's no guidance yet on the 80% payment, which is the reimbursement that the government has now said that they'll offer to employers to reimburse lost wages, then the union branch should make contact with management and ask for this guidance urgently. See if you can find a way to make contact with other colleagues as well remotely to discuss and share concerns and questions around this. The key questions I would say are to ask your bosses, will you be applying to the government scheme? And remind them that it's very much in their interest to do so because it's money from the government to pay your wages. If so, will they pay you before the government's reimbursement money becomes available? Because it looks like there's going to be another 5 weeks until employers can actually access it. And that's a long time to go without pay, especially for those of you who are paid on a weekly or fortnightly basis. Will they top it up with the extra 20%? Now, this is a key question for a lot of employers. And we're going to be issuing some guidance about how you can campaign to get your employer to match that, to promise the extra 20% of wages. And will they still be paying your pension contributions as well? So as leverage, you may want to consider some kind of joint statement you and colleagues could sign, or if you're concerned about being identified, you could maybe set up a public facing petition or something. I'm thinking particularly about the Boycott Wetherspoons campaign that started off this morning, and that kind of reputational damage will really worry bosses. So some things to think about in terms of demanding that. Are we ready to go over to Tim now, Anna?
Yes, we are. Thank you, Shelley. We've covered quite a lot of questions there, so I will patch Tim in. Thank you, Shelley, for some great resources there. Okay, hopefully Tim will be able to join us in a second and we'll get some advice about employment rights. But as I said, do keep posting your questions, and if we can't get to them all, we will provide answers to them, if not today, at a future webinar or in a written form. Okay, I'm going to let Tim have a minute or so to connect. And it's great to see so many of you being active in the chat while we're doing this webinar. It's really important to us that we get information about what's happening out in workplaces during this time, so that we can help you with advice, guidance, campaign information, and so on. So do keep chatting. Okay, it's taking a little bit longer than I thought it would to connect him, but he is there, and I can see the connection is trying to be made. So thank you for your patience, everyone. We'll be there in a second. Lots of people are thanking Shelly for her contribution, and that's obviously echoed by me. It was really great info and extremely helpful. Right, I think we will just, again, I'll come back to Tim again in a minute. I will just go to Sian now. Tim, what I'll try and do is set up the connection with you while Sian is speaking. Sorry again about that. There's just something a little bit slow running with the connection at the moment. But if I bring Sian in, she will be able to talk to us about how coronavirus is affecting people with regard to family policies and family-friendly working. So hopefully we will be joined by Sian in a second. There we go. Hello. Welcome. Go for it. Hopefully you've got lots of information for us about family workers. And as I said, we'll pass back to Tim in a minute.
Hi there, and thank you everybody, and thank you Shelly for all of her help this morning. I found that really useful, just sitting here listening to all of that. Now, we've had a number of questions in around very similar topics, so what I've tried to do are group some of these together, and I know that one of the really pressing, urgent issues in light of the school closures that was announced last week and begun on Monday is around clarifying members' rights in terms of what rights do parents have if their children are affected by the school and nursery closures, and what does that mean for parents' rights at work. And we know that school and nursery closures are causing real problems already for working parents. Lots of mums and dads have no choice but to take time off work to care for their child. And that can mean for many families a big drop in income because not everyone has the right to take time off. So if I just briefly cover what working parents' rights are as they currently stand. So the law allows many working parents to take 2 types of leave, but both of which are unpaid. So many working parents and guardians have a right to emergency dependence leave, And this can be taken at any time without needing to give any notice, and is typically before a period of between several hours and several days. It's unpaid, and it only is meant to cover sorting out an immediate problem, but is often very helpful for parents when they're faced with a sudden emergency. And we know that some parents have already taken that emergency leave when they were faced with these sudden school and nursery closures. Working parents and guardians are also entitled to 18 weeks unpaid parental leave for each child in their care, and that leave can be taken at any point before each child turns 18. That leave must usually be taken in blocks of a week, and you can use it for up to 4 weeks a year. If your child is disabled, you can take that leave in shorter blocks if you need to. And if you are taking parental leave of 4 weeks or less, your employer should hold your original job open for you, or if they can't do that, they are required and you are entitled to a similar job with at least the same status and conditions. However, with that longer unpaid parental leave, your employer is allowed to insist that you give 21 days notice of your intention to take this leave. And we are strongly urging all employers to scrap having to give any notice for that longer parent leave. But with both of those rights that I mentioned, to access those, you have to be an employee. So you have to have a contract of employment and to have worked for your current employer for at least 12 months. So we think these rights don't go nearly far enough. And for most people, the idea of going weeks without pay just isn't an option. We know that millions of people at work aren't legally categorised as employees, so they're missing out on these key employment rights. And Shelly alluded to this earlier, we just think nobody should be faced with the threat of losing their income or losing their job just for following the government's advice in an emergency and staying home to look after their kids. So first of all, we want to say to employers and to reps that they should be facilitating parents to work as flexibly as possible if they are able to whilst caring for their child. So that might mean flexing the working day to take account of the caring responsibilities they have. And then for those parents that aren't able to either work from home or to be able to do their job much more flexibly, we're calling on the government, and we would love your help and support with this, for the government to introduce emergency time-limited changes to allow those parents affected by this to take immediate leave to care for their children at full pay, and that can be reimbursed to the employer by the government, just like they do with statutory maternity pay. And we know for small businesses in particular, this could be a real burden. So we're calling for small employers to be reimbursed at a rate of 103%, just like they are in the maternity leave system. And we think this should apply to all workers, including those on agency or zero-hour contractors, freelancers, and the self-employed. And that's so important because we know that there are many working mums and dads that are included in those categories. And if this help doesn't help them, we're going to see a huge potential rise in child poverty. 2/3 of families in poverty are in working households, and a huge rise in the homelessness crisis that we're already facing. So on to another question. We've had a couple of questions around my 4-year-old child has symptoms of coronavirus. My manager has asked if I have symptoms, and when I said I didn't, they told me I needed to check with HR about where I stand in terms of taking time off. We've had another query about if my child contracts COVID-19, where do I stand? Well, that's nice and easy for me to answer. The government have extended statutory sick pay to include all of those caring for someone who has COVID-19, whether that's suspected or confirmed. So you are protected and entitled to sick leave if your child comes down and is unwell. And that can be advice from the NHS. That's being taken as the advice. You don't need to get a doctor's written note. If NHS guidance to you has been that you should self-isolate, your child should self-isolate because they're suspected of having corona, then you are entitled to sick leave. Now, the government advice is if you live with others and someone in your household contracts coronavirus or has symptoms believed to be coronavirus, then they must stay home for 7 days, and all other household members, even if they remain well, must stay at home and not leave the house for 14 days. So throughout that period, you are entitled to statutory sick pay. And the 14-day period starts from the day when the first person in the house became ill. It's really likely that people living within a household will infect each other or be infected already. So staying at home for 14 days will greatly reduce the overall amount of infection the household could pass on to the others. But with the government advice yesterday, we all should be staying home as much as possible and only leaving the house if there is one emergency journey or travel that we need to make a day. So employers should already be respecting and supporting parents who have a child who is unwell to be staying at home and working flexibly from home wherever possible. I will post the link to government advice on COVID-19 stay-at-home guidance, just in case that's useful to anyone. I'll post that in the chat for you. So we've also received a couple of questions around what are your rights at work if a member of your household is on the vulnerable persons list. And this has changed in terms of, again, all households should be working at home wherever possible. Employers should be supporting all employees and workers to do that wherever is possible, other than those essential workers. And even those, if it's possible to do your job from home, it would be fantastic if employers and reps are bargaining for that. If you do have anyone in your house that's on the vulnerable persons list, then you should all be taking the appropriate social distancing measures. So as well as staying at home and washing your hands frequently, trying to maintain social distance within the house as much as possible, which is difficult if you're caring for somebody, if you're caring for a child or somebody with disabilities, and that can be incredibly hard to do. So obviously, guidance is needed there. But we strongly suggest that if you are being asked to go to work and you have somebody in your house that is a vulnerable person, in the first instance, talk to your employer about why you think that you need to stay away from work and be allowed to work from home or be allowed to be at home on full pay. And if you and your employer fail to reach an agreement on that, we would really urge reps to step in, contact your rep, or if you are a rep, begin negotiating with employers to make sure that they are supporting all staff who have vulnerable persons in their household so they can protect and shield them from this virus. We had another question in here. So Falkirk Council have recommended that pregnant teachers do not attend work. Should this be the same for all pregnant teaching and support staff? And now Shelly's covered some of this in terms of the health and safety aspect and protective clothing and what measures schools should have in place. But I thought this was really relevant because it also applies to all pregnant workers. Now, pregnant women are no more likely to contract COVID-19 than the general population. However, for a very small proportion of pregnant women, pregnancy can alter how your body handles severe viral infections. And therefore, the government has issued guidance that advises pregnant women to observe stringent social distancing measures. So employers should be supporting pregnant women to follow all of the social distancing guidance, so avoiding any non-essential travel, significantly limiting any face-to-face interactions. But obviously that has huge implications for pregnant women, whether they're teaching, whether they're healthcare professionals, whether they're retail workers. And what we would say there is that employers have a legal obligation to assess the workplace risks for pregnant employees and their unborn children. And they must keep these risks under constant review as circumstances and government guidance changes, but also as your pregnancy progresses. And they should be working with their health and safety reps in the workplace to identify those risks and then to mitigate them. And so if that is a retail worker, it is moving you away from being on the shop floor. Can you do something which means that you can maintain social distancing? If it's teachers, it's about whether you can be redeployed to suitable alternative work with no loss of pay for anyone affected by this. And if redeployment is not possible, it's allowing that pregnant worker to work from home on full pay, or to be at home on full pay. We know that different trade unions are giving different guidance on this. So, for example, NEU have told all pregnant workers that if they're told they can't work from home, that they should withdraw their labour, because they are a vulnerable worker due to being pregnant. In terms of your rights there, it's really important that you discuss the situation with your employer, and if your job does not allow for home working, or if your employer is unable to facilitate this, then you, in our eyes, protected by law against any unfair treatment and dismissal if you were unfairly treated because you had to take leave because of your pregnancy and maternity, no matter how long you've worked for your employer. So, for example, if an employer tried to force a pregnant woman to go to work or disciplined her for not going to work, this could amount to unlawful pregnancy discrimination. So if you're a trade union rep, we would really encourage you to make your pregnant women that you're supporting aware of that and aware of their rights here. The Royal College of Midwives have also produced some specific guidance for healthcare professionals, and I can share that with you in the chat box link. Your other maternity and pregnancy rights are not affected, and for a list of them, you can see that in full on the ACAS website. But one word of caution here, and we are launching a campaign around this. If you move into self-isolation and your employer moves you onto sick pay, it can affect pregnant women's eligibility for statutory maternity pay, as your average income could fall below the qualifying threshold. So the lower earnings limit for statutory maternity pay is £118 per week, while statutory sick pay is £94 per week. So that could put many pregnant women below the threshold. That is why we are calling on the government and employers to ensure that pregnant women can be at home, either work from home if that's possible, or be at home without any loss of pay. Otherwise, this really penalises them during this period, but also once they've had their child and they're starting to claim statutory maternity. We've got a couple of petitions going about some of the issues that I've raised. We've got a couple of blogs that I can just summarise some of the information I've shared. So I'm going to post all of those in the chat link now and hopefully hand over to Tim, who can answer any more questions. Thanks.
Thank you so much, Sian. That was really, really helpful. I saw lots of activity going on in the chat with lots of links being shared. We are still trying to get in touch with Tim. He's still trying to connect. I'm going to give it another minute or so. If it doesn't work, please don't worry. We'll get him back on a future webinar, and we will still get him to answer all your questions that you've got about employment rights or anything else that might come up to do with this. It's been fantastic to see so many of you join in the webinar today and share with us what's going on in your workplace. As I said, we will be posting via email all links, all resources shared to you. We'll be sending you a link to the recording of this webinar, so you'll be able to come back and watch in your own time. So yes, please share this widely, and we will be doing a series of these. We're going to try and do a webinar every week, so because we appreciate it's a difficult time for everyone, and we need to keep you updated. I've just seen a message from Shelly saying that she could actually answer some more questions. So maybe I will actually just switch to Shelly for the minute. That might be helpful just for a few minutes, Shelly, if we can bring you back in. And Tim, I will take yours off, and we will get you back for a future webinar. Right, so Shelly should be joining us in a second. And
am I here?
Here she is. Excellent. Let me just bring her up. Okay, go for it, Shelley.
We've still got a few more minutes, so I thought I didn't get through all my questions, and there's a little bit of overlap between my area and Tim's area anyway. I've started to respond to some of them in the questions box, so if you did post anything in there, have a look and see if I've replied to you. But as Anna said, anything that doesn't get replied to today, we will send around later. So trying to remember where I got to. So one of these questions that came in says, our employer has put in extra cleaning and social distancing measures in our main office and is still asking staff to come in to do work which we consider could be done from home. So if you're a key worker who's still being told to work, but you do think you don't necessarily have to go in to do that work, I don't know if the person that asked this question that applies to, but let's say it is. I say, firstly, check your contract or your staff handbook, because it may be that you already have the right to negotiate working from home. And if so, the union should use this and immediately ask management to make those adjustments. If there is no existing provision, but you know working from home is feasible, then I'd say get organised over it. You could try an open letter to management, but if you don't want to do that, you could try and get the public to sign it, as I kind of said to the bus drivers earlier, calling on them to implement home working, try and get the public involved, bring a bit of shame on the employers. And if you need to escalate, I know somebody has also referenced section 44 of the Health and Safety Act. One union branch has already cited it and walked off the job over fear of contamination in the workplace. So if you are considering that, I would say very, very clearly, contact your union's legal teams for support. We're still trying to get advice on that as to whether COVID-19 would be considered legally a reason to cite that and to walk off the job. But if you do that in order to work from home, it's not exactly a strike, is it? Because you're actually demonstrating that your demands are both reasonable and viable, because you're walking off the job to go and do the job at home. But just bear in mind, there are groups of workers as well where it's not possible for them to work from home. So as well as working on your own demands, you should be calling on bosses to consider whether it's really necessary for those people to be at work at all. And if it is, then make sure that while you're working from home, they've got everything in place to ensure they're working in as safe as an environment as possible. And if it isn't, push to ensure that their wages will remain covered regardless. Another question here, do I have to go into work or can I choose to work from home if I am able? Again, the government has advised employers that all workers who are able to work from home must do so. And it's obviously not just for your safety, it's for the wider public safety. If they continue to refuse and insist that it's not a job that can be done from home, and then obviously there is the option of them applying to the government's wage reimbursement scheme, which will cover up to 80% of your pay. But again, if you fall into that 1.5 million that the NHS has identified as needing shielding, then you should absolutely not be going into work at all. What more questions have I got here? I've got one more, I think. No, I think that's it actually. Offices being closed and agency staff not being covered.
No, we can make that your last one.
Yeah, just a quick note about obviously not everybody in your workplace will be on the same kind of contract. So bear in mind any agency workers, anyone who might be on a 0 hours contract. And so when you as a union rep are making certain kinds of demands, just ensuring that everybody's treated equally, nobody's cut out of any kind of negotiations or pay deals that you might be able to win for your colleagues.
Thank you so much, Shelley. That was really helpful, as was all the rest of the contributions from you and from Sian. Really apologise for the little glitch we've had with getting Tim connected, but we will get him connected on another webinar soon. If you've had any problems with loading the video or getting the audio the whole time, don't worry, you'll be able to watch a recording of this hopefully by the end of today, but if not, it will be available tomorrow. Please sign up for future webinars. We'll be advertising them within the next few days. We'll be sending out an email to you all to encourage you to register. So thank you so much for joining. It's been fantastic to see so many of you online, and please stay safe and take care over the next few days, and we'll see you soon. Bye.